Hello everyone. Have you ever wondered why some people tend to have difficulties in speech and swallowing after a stroke? So we'll be discussing about that. Hi, I'm Harsha. I'm speech and swallow pathologist at PRS Neurosciences. So here we'll be discussing about this topic. So what is stroke? Stroke is a very common condition. Okay, it happens when blood flow to the brain is suddenly interrupted. So this can happen in two different ways. Either the artery that is carrying blood to the brain gets blocked, or sometimes the artery itself can rupture, and this can cause bleeding in the brain. Now, our brain is a very smart organ. Okay, it has 4 different lobes. Okay, and each of these lobes have different functions to control. So one area will be controlling the movement, another area is dedicated to speech, another area for language, for swallowing, and for vision, and so on. So let me explain with a few examples related to speech, language, and swallowing. So as I told, frontal lobes helps in producing speech. So if a stroke affects this area, people tend to have difficulties in forming words, sentences. Their speech tends to be very effortful. Okay, so this kind of difficulty, this is what we call as Broca's aphasia. So another type is where people tend to have difficulty in understanding what the other person is saying. So temporal lobe is one area in brain which helps in understanding of speech. If a stroke affects this area, that is when you develop something called as Wernicke's aphasia. Okay, so there people are able to speak, but whatever they speak tends to be irrelevant. They use irrelevant words and sentences. They are able to speak fluently, but whatever you ask them, that they are not able to understand what others are saying. Okay, that is another type. Now, there is another part in your brain that is called as a brainstem. It comes in between your brain and the spinal cord, and it is located at the back of your head. So this part controls several vital functions like swallowing and respiration and so on. So when a stroke affects this part, people have difficulty in swallowing. So the main symptoms that is shown might be they might have difficulty in chewing, they might have they might get cough and choking while they are eating food or liquids. So there are several other areas also that help in swallowing, but this is one main center where it is being controlled. So a patient that develops such a swallowing difficulty is, we call that condition as dysphagia. So as you can see, there are different areas that might get affected following a stroke, and different functions are being affected. So it is our duty as speech language pathologists and swallowing specialists to take care and bring them to their functional independence as much as possible. So the good news is, with early therapy and early identification of such problems, many people do improve. So as speech and swallow pathologists, it's our job to help stroke survivors to regain their ability to speak and swallow. So if you notice sudden problems in speaking, swallowing, some drooping of the mouth, or sudden difficulty, weakness in moving the hands or legs, for anyone around you, it's important to get urgent help, urgent medical help. We hope this video helped. So if there are any doubts, you can leave a comment below. Thank you.